Thanks, Cato. So my mom always taught me to start everything we do with a word of thanks and praise. And so to start off this whole session, I want to give you two early points, I would say. So one is talking about Joan Reede. So a lot of you know Joan's career, and a lot of you have seen Joan speak and do things, but I believe that Joan has actually changed the trajectory of this discussion around diversity, and I believe that Joan has actually set our country in a new path in a variety of different ways, and I'll illustrate a couple of those things. So one is, I would have never known where Harvard was, or even been to Harvard, if it wasn't for Joan Reede. So the first time I came to Boston on the visiting clerkship program, it was through Joan, and I ended up staying in the Harvard system for about 8 years. And Joan has done a similar kind of career building for hundreds, I would literally say hundreds of medical students and residents and fellows across the country. And we don't take the time that we often should to recognize people when they're here with us. Sometimes we say nice things afterwards. But Joan is here with us, and I want to take this note and time, Joan, to say thank you, not just for what you have done professionally, but what you do personally for all of us. All right. And likewise, you know, when you see folks like Cato and Dr. Morgan and some of these guys who are accomplished in their own clinical realm, do this kind of work. They personally behind the scenes are so committed. Cato has provided mentorship for me in a variety of different ways and recommendations and all kinds of different things throughout my career. And it really is where these folks serve not just by words, but by example. And I think it's important for us always to recognize people when they do good things and also call people when they don't do good things, call them on it. But, you know, we have some folks here who are really genuinely committed, and it's important for us to, like I said, recognize them. All right, so let me give you a little bit of background on this whole session that you're here witnessing. Last year I was at NMA, and it was in Hawaii. Thank you, NMA. And while we were all having a good time, I was walking with Joan, and Joan said to me, you know, if I could name 15 of the future leaders, folks, both men and women from African-American backgrounds who I thought were going to be leaders in the future. And she asked me to name 15 of folks who I would consider young talent. And I struggled. I think I got to around 9, Joan, if you remember. And then Joan said, you know, it's a problem that you can't name 15 people. And that in itself is indicative of the challenge that we're facing. I like to consider myself somewhere in that realm. I just turned 40 a couple of months ago, but I guess that's no longer young. But, you know, when we were thinking about that whole dynamic and discussion, it reminded me of a friend of mine who is involved in politics and is in the Democratic Congressional Leadership Group. And he said, the future of the Democratic Party is in the future of its young leaders. So I thought to myself at that time when I was having that discussion with Joan, what's the future of leadership in terms of African-American medicine if we can't readily identify a pathway, a pipeline, whatever the optics are on who's going to be leading either clinical medicine, public health, policy, administration, whatever you want to define it as. We can't readily see who those people are and help support them and lift them up. Then we face not only challenges now, but we're setting ourselves up for challenges in the future. So hence was born all the momentum with Cato and other folks coming together to bring this group in front of you here today. And I guess because I'm a part of this discussion, I believe this is one of the most important discussions we'll have here at the NMA, talking about pathways to leadership, more importantly, for each of you here and recognizing these folks who are here on the panel, Gail included, who is young at heart, if not young in age as well. Recognizing that we have to support these individuals here and make sure that they continue to succeed because they really are the future, if not the current leadership, from academic to government to policy, et cetera. So moving forward, I hope that what me and Joan talked about back then is having this be the spark for ongoing discussions and initiatives and all kinds of different activities going forward, where we try to build and support the network of young leaders, particularly folks who we believe have the ability as well as the potential to really lead our healthcare system moving forward. And so I'm going to introduce 3 folks here to you today who we think are representative of that. But again, the discussion really is not just about them and their activities, but how do we, as an organization, identify and lift and create a network that builds the future of either clinical medicine policy or healthcare, in whichever way you want to define it. So quickly, I'll give you the bios of the three folks, and I'm really excited about these individuals. The first, Dr. Landry, and really, not only is he a classy dresser, as you can see here, but this guy, I met him first a couple of years ago through the Tour for Diversity activities that he and another physician were doing, where they were bringing young high school students into this issue of talking about science and healthcare, et cetera. And it struck me that he had the ingredients of success, not only in terms of his own clinical acumen, but the ability to have the vision for setting our programs like these to build this pathway in terms of medicine and healthcare, as we've been talking about. And so let me give you a couple of his credentials. He's an emergency medicine physician at Beth Israel. He is a founder of Motivating Pathways. He also holds academic leadership positions at the Disparities Solutions Center at Mass General, and then works as well in the Office of Diversity and Community Partnerships at Harvard Medical School. And he's going to talk to us a little bit around the pathway around entrepreneurial leadership and some of the things that he's been doing there as well. Second on our panel, we are very pleased to have Dr. LaQuandra Nesbitt, who is a board-certified family physician and who recently became the director of the DC Department of Health in Washington. And we have to do whatever we all can to support your success in that very, very, very challenging role. That's a very challenging role. But she has already been successful in her career, having previously led the health department in Louisville and done a number of other things, both in Baltimore and other places as well. And she's going to talk to us a little bit about pathways in terms of leadership around health policy and governmental leadership. And then last, in terms of our three initial panelists, we're also going to have Dr. Yashiko Watkins. And her career has primarily been built around academic medicine. She's an assistant professor in the Department of Health Studies in the College of Health Sciences at Chicago State University, and has been doing research and things around colorectal cancer, osteoarthritis, and diabetes. And she's going to talk to us a little bit around pathways to leadership in the academic setting. And after, they're going to make some initial remarks, and then after that, we're going to hear from Gail Christopher, who needs no introduction, so I'll just say, Gail, thank you for being here. Gail has really set the tone for a lot of the discussion we have as a country around race and healthcare and some of the stuff that's been done through the Kellogg, her leadership of the Kellogg Foundation. But really, Grace has been, not Grace, what did I say, Grace? I'm sorry, Gail has been doing amazing things from her prior roles in a number of different settings. And certainly, I think when I first met Gail years ago, I remember our first lunch where she talked a little bit about just about her passion around issues around health disparities. Gail, I think that must have been around 2003. Yeah, it was around 2003, 2002, around 12 or 13 years ago. And one of the things that I think everyone across the country admires Gail for is not just her generic intrinsic passion around these things and the things that she say, but she backs it up in terms of the initiatives that she has both led and supported and the track record that she has built with her own individual career. So I'm honored to really have Gail be a part of everything that we're going to be doing here today. So we'll hear from each of our three panelists, and then allow Gail a couple moments to respond then as well. And then we'll get into a discussion with this group. And one of the things I want you all to do as you hear from all these folks, as well as hear from what Gail is going to say at the end, is not just come up with questions about, you know, things that they should do better, but things that you all can do to help really uplift this whole discussion. So I really want us to really talk about how whoever is going to stand up and talk, I want to hear a little bit how you're going to help us in terms of building this huge new network we want to build around the future of leadership in healthcare and medicine and public health. And so that's the vein of the discussion we want to talk about, is hear a little bit about how things can be done, but then talk about how we help build this as a movement in the future moving forward. So I remember Joan said something to me when I was having a hard time, it was around 2008 or so, and she said, you know, a lot of people can complain, but not a lot of people can do things. And so we want to move this into a discussion, not about complaining, but about how we go about doing things. I'm certainly, Joan, in honor of your leadership and the way you do things. All right. So.